incidence of VOD, veno-occlusive disease, or SOS, sinusoidal disorder, differ. Traditionally, they've been shown a higher incidence in young kids versus adults. Now, the diagnosis of VOD can be quite subjective. And so it's unclear whether the higher incidence is based on the physicians diagnosing those patients more aggressively in children versus adults, or there's underlying biology. I would posit there's probably a combination of both. So in fact, we did a study recently at MD Anderson where we took a retrospective look and looked at patients across the board who had veno-occlusive disease. And it is true that there was a higher incidence in younger patients. I think risk factors such as the drugs that they're exposed to, so drugs such as inotuzumab or other azole therapies, drugs that are hepatotoxic if the patient has had prior exposure to hepatitis infection, if the patient is getting a second transplant, or obesity or hypertriglyceridemia. There's multiple factors that can increase the risk, but it is, for whatever the reasons are, we do tend to see a higher rate of veno-occlusive disease in younger patients versus old.